Yeah, so for the 240 tests, you'll do the household measurements, metric to metric, household to metric, pounds to kilograms. You'll see that intake output question, the one that it's usually about the urine output, replacement volume question. You're gonna do your typical oral based meds, so capsules, tablets, milligrams, your parenteral medications, again, milligram or milliliters. And that's what I meant to say with the oral based medications, milliliters, not milligrams. You'll do your insulin dosages, including mixing of insulins, reading a sliding scale, doing some insulin infusion questions, meaning calculating or converting units per hour to milliliters per hour. Um, you'll do, like we mentioned, the heparin question. The heparin bolus, you'll probably see like one question for the heparin weight base, and then like a few questions, maybe two or three questions for the infusion ones, which is just again converting units per hour to milliliters per hour. And then there's the nitroglycerin drip, which is the one that is it starts off in like micrograms per kilograms per minute, and you have to get it to milliliters per hour. If you recall that question, I think you saw that question last semester. But I'm gonna pull up your review. I don't know that this obviously I'm still working off of the spring 2024 um uh uh, review. So if this is different, I don't have an updated one, but if there is something different, just you can let me know. Yeah, the I would say the session tomorrow, like for 240, I don't have any specific things that I go over because you guys are like this is your final semester. You've seen it all. You've worked through these things and you know well enough to go through the practice packet. And if you have any specific questions, that you'll ask that. I'll probably go through like today if I don't have any specific questions. That I'll probably go through the heparin protocol and the nitroglycerin drip. Um, um, oh, okay. Yeah, so I imagine they're the same wrong answers for the spring 2020. It's probably the same test. Um, which question numbers were wrong? Because I'll know once I look at the key. All right, 4 and 11. So let me just see here. Oh, I don't even know that I have the key here. I may have gotten rid of the key on my copy just because. Let me just see if the question 4 is the same question. Oh, okay, yeah. So, um, you should have 30 milliliters as your answer here. Okay, here we go. I think it's the same. I don't know if it's going to let me open
Dr.
this.
Rad, for that one, the answer key had 60.
Yeah, that's what I'm saying. It's the same. It's the same like the same test.
Okay.
So, but let me just open this up because I think it's the same questions. Give me 1 second here. There we go. And let me just switch to the same one you're looking at. Like I said, I think it's the same. I don't think they changed it. They just changed the date. Yeah, so number 4 should be 30 ml, right? Because 1 tablespoon is 15, so 2 would be 30. And then you said number 11. Okay, yeah, this is the one. It probably said like 13 point, well, let me see here. 11. Oops. 22. Oh, yeah, that doesn't make sense at all. All right. Should we go through number 11 just to make sure? Because that was one that I was going to go through anyways because it's the um the micrograms per kilogram per minute.
Question on.
Okay. Yeah, just to make sure you have the right answer. when you do this. So, okay. Yeah, that's that is correct. Yeah, the 13.1, or for some reason I think it's 13.2, but I just might be remembering wrong. But yeah, we'll just make sure you got it down. So, thing I hate about these questions is like they're super long. Like um but the big thing is when you're going through this question, you have micrograms. Thankfully, the patient's weight's already in kilograms, and then you have milligrams. So you just have to convert. You have to convert either excuse me, milligrams to micrograms, or convert micrograms to milligrams, and you have to convert minutes to hours. So you just have to kind of do all those things. You could do it stepwise. You could do it as one long dimensional analysis. It really is up to you. If it's me, for simplicity's sake, I'm going to convert the 400 milligrams to micrograms just because I'm doing less with this here, and I have to do so much more with this, but either way it works out. Okay. Um, Let me just do it the long way. So the first thing I would do is I would take my 70 kilograms and I would multiply it by the 5 micrograms kilogram per minute. So we're getting rid of kilograms. Um, if I'm setting this up using like dimensional analysis, I won't set this to equal. I'll just keep going. But I'm gonna just kind of chop it up for the time being. So I'm gonna get 350 micrograms per minute. The next thing I'm going to do is I'm going to convert minutes to hours, mainly because I want to get a nice big number before I convert the micrograms to milligrams. Make sure I'm doing this right. 70 times 5 times 60. Okay. Yeah, so I'm going to get 21,000 micrograms, and then that's per hour. And so what I've actually done is I've basically eliminated, or I'm in the hours, which is what I need if I'm looking for my infusion rate. And if it's been a little while, remember your infusion rate is typically milliliters per hour. Even though it doesn't say it, that's what that would be. So the next thing is I can't do anything with the micrograms. I have to convert that to milligrams because my available is in milligrams. I mean, yeah, milligrams. So all I'm going to do is I'm going to show this. You could do this whichever way you want to do, but I just always like to show it. That way you remember if you ever get stuck and you ever multiply when you should divide or divide when you should be multiplying, this will help you out with that. And the other thing I'll show you is 3 zeros, 3 zeros. And so this is 21 milligrams per hour. And then we're going to um, I'm just going to do this is now I'm kind of switching gears and doing more of a um, desired over available times my 250 ml because I'm running out of space. And then that's where, so 21 times 250 divided by 400. Yeah, 13.125. I think that used to be what the answer was listed as. It used to be listed as 13.125. But you got to round it to 13.1. So you were right, Jeremy, when you said 13.1. I just couldn't remember off the top of my head. It's been a while since I seen that question. So like I said, you can answer that question any variety of ways. That's just the way that I've chosen to answer that question, just going in those steps. Me personally, I'm writing out all the conversions and then just doing all my multiplication division all in like kind of one kind of step. But if you do it stepwise, like I shown, that's perfectly fine to do as well. So if you got 13.1, then you were doing the question right. So Are there any other or any questions that kind of stood out on this practice test that you had difficulty with, or was everything pretty straightforward? Number 29, thank you. Okay. So, for 29, the flu vaccine, zero point 0.5 mil, mark the dose on the 1 mil tuberculin syringe. So what you want to do is you have to figure out where are your milliliter marks. So these are not milliliters. I think they're molar. I don't know what these M's stand for, but the clue is 1 mil tuberculin. And notice that this is one, so the whole syringe is 1 milliliters, 1 milliliter. And so if you're marking the dose, this is where you're marking it, right at the 0.5. So I will say that sometimes that's like, especially when you see this and you're like, what the heck am I looking at here? Like I said, I don't know what the 4, 8, 12, 16 is. Those could also be apothecary like measurements. I doubt it because usually it's like grains and um drams, which is these are not the indication for drams. So I don't know what the M stands for, but I do know that if it's 1 mil, then that's what it is. 20-meter syringe. Yeah, that would be an impressive syringe. All right, good question. Any other questions from the practice set that kind of stood out? Even if you got it right, if you just want to make sure you're setting it up correctly, those are great questions. Okay. Yeah, like I said, the only thing that was like, it's not necessarily new, it's just reminding you, like, with the heparin and then realizing that this is a whole protocol. But if you feel good about that, then that's fine. Like that, I'm not here to tell you it's any different. It's going to be the same types of questions where they're going to ask you, to answer, two questions. Yeah, it doesn't look like they added more to this than what they've had. It's just kind of organized very similarly. And then like now well, obviously these are incorrect. So 4 and 11. I don't know what happens there, but I can tell you it wasn't me. Chrissy, Mark, do either of you have any questions from the practice test or other like similar questions?
Sure, that was 11 was the one I had trouble on, but now that you explained it, it makes sense.
Okay, good. Yeah, you probably will see one of those questions, so just take your time going through it. It's probably going to look very similar. They'll just either change the order or the available.
Yeah, well, and I couldn't understand why the answer was 22, so that was really screwing me up. So now
Okay.
I
You're like,
understand. Yeah.
what were you getting 13.1 that whole
Yeah, I
time?
did, but then I was like, well, this is wrong. So I was doing it all kinds of crazy ways and I like could not figure out how to get 22. So
Okay.
yeah,
Well,
thank you.
yeah, you're welcome. Yeah, because the answer is not 22.
Right. Yes, that makes sense now.
I was also here for 11.
Okay. All right. Well, good. Yeah. I don't know if they intentionally put that in there, so I have something to do with you guys. But like I said, I didn't give them that answer. I don't know what happened there, but I'm glad we got it cleared up.
Thank you.
Yeah, you're welcome. Yeah, I'll stick around. I'll be hanging out here. If you have any questions, just unmute. If you're good, like I said, I'll be here tomorrow. You can always email me if you have any questions. But if you feel pretty good, your practice set for 240 is probably the best practice set of all the classes because they actually give you some extra questions more than what you're only going to have 25. So, um, if you could do all these questions, you should be good to go.